Hello, investors, and welcome to Stocks to Watch, where we spotlight the innovators driving the future of healthcare, tech, and much more. Today, we're featuring Intelligent Biosolutions, trading on the Nasdaq under the symbol INBS. They're a medical technology company revolutionizing drug testing through non-invasive real-time solutions. I'm thrilled to have Doug Heath with us, Vice President of Global Sales. Doug, welcome to the show. Thanks for joining us.
Thank you very much for having me, Ashley.
Yes, it's always a pleasure. And I know today we're going to explore your latest global distribution agreement, how the company's novel SMARTOX patch is poised to transform drug screening across justice, rehabilitation, and workplace settings. So important. So I want to jump right in. This new global distribution agreement with SMARTOX is a significant milestone. So why would you say now is the right time for Intelligent Biosolutions to expand its partnership globally? Before we continue, be sure to subscribe to our channel and ring the bell to get notified about our latest videos.
Thanks so much. Yeah, I think anybody that is following Intelligent Biosolutions will be well aware that one of the key goals for our business is global expansion. We have a very strong and very good product in the fingerprint test that we operate within drug screening. But as we spread across to different regions and different areas of the world and pursue that rapid international growth, having something extra in our toolbox, if you will, is really going to benefit us. So we're not straying from the company message, the ethos around testing or anything like that. We're simply adding to our portfolio as we grow around the world to be able to meet the needs of each and every client that we come across.
Yes, and speaking of this global growth, the agreement, how would you say it really enhances international customers' access to testing solutions? And in what ways does this build on your current relationship with SmartTox?
Absolutely. So we've worked with SmartOX for a number of years, and they've been early adopters of fingerprint testing within the United States. The company continues to pursue FDA approval as the key sort of milestone for growth within the US and accessing the largest drug screening market that there is sort of worldwide. I've worked with fingerprint testing for upwards of 6 years. It's a tried, tested, proven testing method, which is helping many, many companies around the world, and one that we look forward to launching within the US. But outside of that FDA market, there's a forensic use only testing market, which we have worked in alongside SmartOX for a number of years. They have a strong understanding of our product, how it works, and have helped us win some business there over the past few years. SmartOX developed the SmartTest sweat patch as a response to the market and a market need for a product such as this, primarily in drugs rehabilitation. It's not so much of a workplace product. It's more of a drugs rehab product due to the different ways in which it monitors substances. So having that innovative technology sit with them and a company that we've worked alongside for a long time, and the ability to bring it alongside us and really enhance that partnership is hugely important for us, especially when we look forward past operating in forensic use into operating in the broader market in the US post FDA. It's a soft introduction when SmartOX have been with us, where they can continue to deploy our product into the market with all the learnings they already have. They're not coming into this with fresh eyes, and neither are we as we launch their product around the rest of the world.
Yes, and it's so needed. You and I have talked about this before and the importance of this. So, best of luck to you as you're pursuing the FDA approval here in the United States. I'd like to know about how it really differs, the Smart Test patch, how it differs from your current footprint. I know you talked about it a little bit, but why would you say it is particularly well suited for justice and rehabilitation settings?
To sort of cover off drug screening as a whole, there is no system that tells you somebody's impaired. All they say is you've consumed a substance within a specific time frame. Now, one of the unique aspects of fingerprint testing, and probably the biggest selling point, in all honesty, of fingerprint testing, is the short detection window, which we have. When you know somebody has consumed a substance recently, the likelihood of that individual being impaired is much, much higher. If I was driving my car and my breathalyzer worked like a urine test, and you said, "Oh, I'm very sorry, Mr. Heath, but at some point in the past week you've consumed alcohol. Am I safe to drive?" We don't know. However, if it has a short window like fingerprint and I've consumed alcohol in the last 12 hours, that's time to take my keys off me. That's kind of why a fingerprint test works and why it's unique. That being said, if the only thing I have in my toolbox is a hammer, I'm going to struggle to fix my plumbing. So we need to have a variety of tools available to us each and every time. And bringing the SMARTOX sweat patch in-house gives us exactly that. Rather than having that short window of detection, it has a much, much longer window of detection, operating a little like a tape recorder, constantly monitoring things that are being metabolized through an individual over a 7 to 12 day period. That gives people the opportunity for that constant monitoring as opposed to that short monitoring, without straying away from any of our company messaging. We're still incredibly non-invasive. We're still incredibly easy to use. The application is quick without much, without much specialist training being applied to it. We're still monitoring within sweat. So all the things that we have sold the fingerprint sweat testing method on apply to this, but we just have a differing detection window and a differing way of monitoring people. So for me, it's a really, really exciting product. And of course, overall, what we're also doing here is we're establishing yet again sweat as a viable detection method for drug testing. Previously, we spoke, Ashley, and we've mentioned, people switch from urine to saliva because of ease of use, a shorter detection window, a much more pleasant way of testing. And now we're going from saliva to sweat. And this really is the future of testing. And I think the work with SMARTOX, the work in this agreement is going to benefit both organizations and allow us to reach a broader customer base around the world.
Yeah, incredibly innovative work that you're doing. And I have to imagine that it's very useful to law enforcement. Curious, what types of substances would you say the Smart Test patch can detect? And how does it, the drug panel enhance or extend your current offering right now?
The fingerprint test, initially is a screening test. We're going to get an immediate result from that to determine what drugs are present within their system. And what we detect on that are the most prevalent drugs in day-to-day society, the ones that people are likely to be using and likely to affect their ability to work or carry out any function. Both protecting them and the people alongside them and the people they run into in day-to-day life. We're trying to keep people safe and we're trying to deter people from using drugs. Now, the sweat patch differs ever so slightly as you wear it for a constant period and it monitors usage over that time. When that patch is taken off, which it can only be taken off when sort of required, it has a tamper-evident covering. It's a very smart piece of technology, and it's by far and away an improvement on the incumbent solutions that are already in the market. When that patch is taken off, it's then sent off for laboratory analysis. So we're not getting that immediate reading per se, but it's going off to a lab. When the lab analyze that, they can analyze that for a much, much broader spectrum of drugs. And that includes extended opiates as standard. So, and not just morphine-derived opiates, we have synthetic opiates on there as well. We're going to get levels of all these substances on here as well too. We have fentanyl on here. Really important to understand that. There's some huge learnings from understanding where the fentanyl is present. That's on there. We're picking up drugs sometimes more often seen in a drugs rehabilitation setting here as well. So something like methadone, which I may well be prescribed to take if I was to be coming off an illicit substance such as heroin. So it fits into these different markets, much more extended panel. We're learning a lot more from it. And obviously we're learning that over a larger period of time as well.
Yeah, and a couple of things I want to highlight here. You used a word, Doug. You said protection, and I think that is so important. It's about protecting the community. And the other thing is that every time you turn on the news, you see something about drugs, you see something about overdosing, you see something about confiscation. So, the work, again, I will reiterate that you're doing is so important. And as this testing market expands and customer expectations evolve, what trends would you say you're observing in the demand for non-invasive testing?
Well, I think we've established previously that drug usage is on the rise. And with things such as legalization, drug usage is here to stay. It's a reality of the world we live in. And having something that can combat that and work alongside that is immensely important. In my experience, people will only test at a high frequency if it's cost effective and if it's easy to do so. Testing has an implication on business, it has an implication on day-to-day lives. But by having a non-invasive, cost-effective, easy-to-administer test, it becomes prevalent and it brings that protection that we discuss. the short window of fingerprint testing fits perfectly into a workplace testing environment where we can monitor whether people are safe. We get that high suggestion of impairment. It's easy to administer, and we're catching the people we want to catch. And we achieve that through fingerprint testing, and we drive that deterrent from, being impaired in a setting where you're putting someone or yourself at risk. Now, the SmartTest sweat patch allows us to monitor things in a different way again. It's a discrete product. If you are going through a rehabilitation program, if you are coming off drugs and need some assistance with that, you can wear this and nobody knows you've got it. But it gives us the bigger window. We gain that clearer picture. We see things over time. We can analyze trends. We can understand usage. This can be used for alcohol as well as drugs to help people with issues that they may be experiencing with that. So I would say drug usage is here to stay. We need to be able to effectively tackle it, but tackle it in the correct ways and with a modern attitude, especially when it comes to things that are legalized substances. What really excites me here is the ability to do this in one arena in the workplace, another arena that's just rehabilitation. We're keeping the company message. We're still being non-invasive. We're still hygienic, yet we're hitting all these demands. And it's an exciting agreement for me in the business.
Yes, exciting indeed, which leads me perfectly into my final question here about what excites you most about the potential of integrating this real-time sweat-based data with these wearable technologies that you talk about, the smart test patch. Do you see opportunities that extend beyond drug testing here?
Absolutely. And wearable technologies is a hugely growing industry. I haven't got mine on today, but how many people do you know with an Apple Watch, that monitor their lifestyle, or a Whoop strap and things like that? We're keener than ever to know more about what's going through our bodies and what's acting in our bodies and diagnosing, perceived issues with ourselves. And around the world, it's sometimes harder to get in front of a doctor than it used to be. And anything we can learn and diagnose ourselves and help ourselves with, whether it's fitness, ketones, fertility, we can monitor all of these ourselves and make informed choices through technologies, then that's fantastic. And with something like a sweat patch where there's constant monitoring available, that's a reality. With something through a fingerprint where we can clearly show, there's metabolites present which have these indications. So the future's really bright with both the technologies and sweat as a matrix to detect them in. To fall back to sort of my analogy of the toolbox, we have different tools for different applications and we can apply them where needed. And whichever is the strongest method for that particular application, that's the one we're going to go for. I think we can come up with some really exciting innovations, both within the drug screening and drug testing space, and some medical spaces beyond that in the future. When it comes to health markers and wearable technologies, people want those tests. So it increases the demand from just employers, rehabilitation, to individuals as well. And, something like the sweat patch is a consumer item. So it's a really, really exciting time for the company.
And a big market for it. I so appreciate your time. There's global expansion in motion, cutting edge wearable tech, as you talked about in development. Intelligent Biosolutions investors, check out INBS on Nasdaq. You are certainly positioned at the intersection of healthcare innovation and real world application. So thank you again, Doug, for sharing these critically important insights. And thank you all investors for tuning in to Stocks to Watch.